regarding the. I really enjoy what the talk. What the talk by previous speaker regarding the inflammation and atherosclerosis. In my talk, I would like to share with you some progression in the actually it's a conceptual framework for the chronic inflammation with the aging process. I don't have any conflict of interest for this presentation. So we're in the aging population era and all step to an aged population. According to the UN and WHO criteria, 70% of the population is the age 65 or above. That will be an aging population. This percentage raised to the 14%, and we'll enter an era of age population. So now in 2020, for the global level, there is the 9.3% population is the aging population. And in the next 30 years, very short 30 years, there will be close to the 16% population will be age 60 or above. That means it's the large number of aging population in the population. We have a very large number of aging population. It's very good things for people because they have a longer life. That will have an even longer life in the future. But it creates also a challenge, especially the burden of age-related diseases. And many years ago, I have a collaboration with Dr. Anzhen and Dr. Lee Goldman in Columbia University. We published a paper very early, 30 years ago. In that time, we're trying to identify determinants for the future burden for China. I used to think there will be a risk factor for elevated cholesterol, hypertension, diabetes. But actually, we find that the population aging is one of the largest explanation for future burdens. I really felt the discount in that time because I think that we can do nothing for the aging because aging is inevitable and cannot modify. Another very interesting study that always interests me is a study published very early in 1983. It's a pathology study using very large over 7,000 autopsy cases in Chinese. Then in China, in that time, the Chinese population had very low LDL level. There are very few diabetes and no obesity even, and more physical activity. But you can the autopsy cases actually died from all the disease. Very few of them have a coronary heart disease. Died from coronary heart disease. Then you find that as the age increase, very high percentage already have atherosclerosis in their coronary artery. For over 50 years, the percentage reached to 74%, and even close to the 100% for the people very old. So that means the age is really percent plays some role for atherosclerosis. And for the international global perspective, the one very interesting paper published in New England Journal in 2015, they're trying to identify the drivers for global trend of cardiovascular mortality. Then they find that there are three drivers. First is the increase due to the population growth. The second is the change due to population aging. And third is due to the age-specific cardiovascular mortality rate. That is actually reflect the effect of prevention and all the effort in prevention. And even there is many regions in the world find a decrease mortality, the age-specific mortality from the prevention. But the change due to population aging, the burden is the top reason for the increased trend is population aging actually offset the effect from effort of CVD prevention worldwide. So for a very long time, the exponential growth CVD mortality rate as a chronological aging was considered as the innovative aging process, and the aging was listed as a non-modified risk factor for CVD prevention. But in recent, I believe, 20 years, it's more research. More researchers have the interest in for the mechanism of aging process become increased dramatically, and people recent it's past if the mechanism of aging can be well understood, it may be possible to retard aging process and increase the time of healthy aging for people. More research becomes interested on what is underlying the changes code for the aging process and how. And in 2020, the year 2000, Dr. Frank Costco, I pronounce right, Costco, and a group of multidisciplinary scientists, they proposed a concept of the info aging. So the author of this concept, this actually is from an evolutionary perspective. I am not pronounced right. Immunosenescence. In the figure 4, actually, the author illustrated the concept as how the showing as the increased age. The most significant characteristic is the low pro-inflammatory status to the high pro-inflammatory status, and caused by the chronic age-related stimulation of the macrophagy. So there are two. Actually, is the macrophagy aging is caused by the macrophagy aging and become the inflammatory status high. And the author's paper wrote, we extend the network theory aging. I believe it still is the main hypothesis for the concept, the framework for the aging is network theory. And we argue the global reduction in the capacity to cope with the variety stressor and the concomitant progression increase in pro-inflammatory status a major characteristic of the aging process. But 30 years later, the first review, I believe the first review to try to summarize what the hallmarks of aging by the Dr. Carlos Lopetin and a group colleagues, a group of experts from Europe. Then they actually did not. They summarized the 9 hallmarks for aging, did not include the information. Then they propose ideal criteria for a hallmark of aging. The first one is it should be manifested during normal aging. Then the second is experimental aggravation should be accelerate the aging. And the third most important, the experimental amelioration should retard the normal aging process, increase the healthy lifespan. Then the author of this review, they classify the hallmarks into the 3 levels. The 4 is to belong to the primary hallmark with the aging is the course of damage of as the aging, the genomic instability, thermal attrition, epigenetic alteration, and the loss of protein homeostasis. And also the 3 belong to the antagonist hallmark is actually the response to the primary home damage. Deregulates nutrient sensing, mitochondrial dysfunction, and the cellular senescence. And also that they propose the phenotype for the underlying course for the phenotype is the integrated hallmark is stem cell or exhaustion and damaged intercellular communication, so they didn't include the information, but they put the information as only the one characteristic for damaged intercellular communication. But as the increase the scientific evidence in this field, the info-aging hypothesis has been more accepted now. The review article by Laura Lippert, I think Peter is one of the co-author for this very important review article. Information, the role of information for age-dependent cardiovascular disease. The figure one, actually, I think it's a very good. The figure summarizes put the information in the central role, and it's a very important role as the result or as the consequence of all the primary and the response damage by the aging, the hallmark, and also it's underlying the mechanisms for all the age-related, it's not all of them, many of age-related diseases like CKD and atherosclerosis, myocardial infarction, and through cellular stress response pathway and inflammatory mediators. So I think it's a very simple but very nice way to show how important the characteristic implementation in the whole aging process. And also this review also addressed the role dysbiosis with the information through dysbiosis, and also the systematic effect produced caused by the dysbiosis, then also related with the age-related cardiovascular disease and the cerebrovascular disease. It's a very nice review article. And furthermore, the review paper published in the Nature Review Cardiology also update the hallmarks of cardiovascular disease aging. I believe it's not a hallmark only for cardiovascular disease. Then in this new hallmark, they replaced some hallmarks in the primary and antagonism with the previous one published in 2013. But very impressed that they put the information as the only integrative, the phenotype, for the mechanism, the direct course for the phenotype as the only one integrative, and means the characteristic for all the aging process. So the author consider the information is ultimately promote the manifestation or the progression of cardiovascular disease. And I think that this is more consensus on the central information on aging process. You can find for many publications in recent years, especially this year. Chronic information, another review, even put the chronic information in the center of all the hallmarkers as integrative the hallmarkers. So they conclude between the chronic information and other hallmark age, there is a result in the very vicious circle. Understanding this complex interplay will provide a new insight into the mechanism, aging, and the development of potential anti-aging intervention. And the author also addressed the driver's chronic inflammation may be an ideal target with a high translational potential to address the pathology condition associated with aging. Interesting is the author of they first proposed the 9 hallmarkers in 1913. Then they update their hallmarks too. Then they put the chronic information and also the dysbiosis as the important hallmarks in the update frameworks compared with the 13 years, the paper they published in 2013. So it became the consensus for the central role of information now. And also the Dr. Frank, I may not pronounce right, and the team, they actually create the concept of information agent, also updated their theory this year by integrating the original concept to the later scientific development. Then this figure is still they put the information or information and also the immunosynthesis as the center characteristic for the aging process, but they put more reversible process. And then you can see when they conclude. I think it's very important conclusion. This conceptualization opened the way to consider age-related process in their complexity, means that not only process but also all count processes should be considered. It also opened the way to adding new concepts to the original one, leading to better understanding the nature of inflammation and the aging percent. Finally, showed the way toward potential multiple model intervention involved in the as the holistic approach to optimize the aging process toward healthy longevity. So as we learn from today's talk and all the clinical trial and all the research, the effect and the information treatment in secondary prevention, at least in secondary prevention, I heard there is a primary prevention trial is going on, but currently the evidence showing the effect anti-inflammation treatment in the secondary prevention CVD, I think this has been proved with high level evidence, but it is still a question will open the promising future if the chronic inflammation or drivers chronic inflammation are targeted with a high translational potential to retard the pathology condition associated